This is Rabbit Hole Radio, where we explore stories, mysteries, histories, internet culture, and anything and everything in between that has questions hiding beneath its surface. My name is Megan. Let's get into it.
Welcome to Rabbit Hole Radio.
Imagine finally finding the place that saved your life. A drop in center where people knew your name, a counselor who helped you through your darkest days, a peer support group that reminded you weren't alone. Now imagine showing up one morning and the doors are locked. Not because the need disappeared, not because recovery suddenly became easier, but because the funding ran out. Across Canada, mental health organizations are worrying about what's being called the funding cliff, a moment that could reshape community mental health services for years to come. So today we're asking, what is the funding cliff? Why does it matter? And what happens if nothing changes? First, we have to go back to 2017. In that year, the federal government announced a 10-year, $5 billion investment into mental health and addiction care. The goal was to strengthen community services, reduce wait times, improve addiction treatment, and give provinces the resources they needed to expand support. It wasn't designed to solve every problem overnight, but it was a significant investment in a system that had been long underfunded. But here's the catch, it was always temporary. That agreement is scheduled to expire on March 31st, 2027. No one has officially announced that the mental health funding is being cut, but unless governments replace or renew that investment, organizations could suddenly lose a major source of funding. That's why many experts and organizations, including the Canadian Mental Health Association, are calling it a funding cliff. When most people hear mental health funding, they're not even sure what the money is going towards. A lot of people assume that it's just the hospitals, but hospitals are only a piece of the puzzle. Most recovery actually happens in our communities. The funding supports drop in centers, peer support programs, crisis response teams, youth mental health services, addiction and recovery programs, housing supports, counseling services, and family education programs. These are the places that help people before a crisis becomes an emergency. There are also the programs that often keep people out of the emergency rooms altogether. When people get help early on, everyone benefits from it. People recover sooner, families stay together, emergency departments become less overwhelmed, communities become healthier. Prevention rarely makes headlines because when it works, nothing dramatic happens. But that's exactly the point of these services. I know it's easy to hear the word billions and think it's just another political debate, but funding isn't just a number. Funding pays for the counselor who answers the phone late at night when you're struggling. It pays for the case manager helping, for people to become a productive member of society, finding them housing, finding them a dentist, and getting them back on track where they need to be after a crisis happened. It pays the peer support worker who's lived through addiction or mental illness themselves and can help people advocate for themselves. It pays the rent that keeps community centers open. When the funding disappears, those supports don't magically continue. Organizations may have to reduce staff, cut programs, shorten hours, or close those programs down altogether. And for someone already struggling, even losing one trusted support can make all the difference in their decline. Then you have the other side to this conversation that often gets overlooked: research, innovation, early intervention. Every treatment we have today exists because someone invested in finding something better. The medication people rely on, new therapies approach, crisis intervention models, youth prevention programs, they all started as research. When we invest in mental health, we're not only helping people survive today, we're helping future generations recover faster, live healthier lives, and hopefully preventing suffering before it begins. Without continued investment, that progression slows down significantly. And the reason I'm so passionate about this is because the topic is very personal for me. I've experienced firsthand how important community mental health services can be. When you're in a crisis, These places aren't just programs. They're resources where people can rebuild their lives. They're when hope starts to come back. And I know I'm far from the only person who feels that way. Millions of Canadians have relied on these services, whether it's for themselves, a family member, or a friend. And this conversation is not about politics. It's about making sure help is still out there when someone reaches out. I'm going to get really personal for a second. I first entered the mental health system when I was around 13 or 14 years old. And back then, trying to navigate the system felt so overwhelming. It often felt fragmented, confusing, and incredibly difficult to know where to turn next. There were amazing people working within it, but there simply weren't enough resources. And so many people struggled to get the support that they needed, including myself. But over the last 10 to 15 years, I've watched that begin to change. Is the system perfect? Absolutely not. There are still long wait times, gaps in care, and far too many people who can't access it when they need it. But I've also seen real progress. I've seen more community based programs, more peer support, more recovery focused care, more recognition that mental illness doesn't simply disappear because someone leaves a hospital. And I think that's something a lot more people need to understand. A hospital might keep someone safe during their darkest moments, but recovery usually begins after they leave. That's where community mental health organizations step in. They're the people who help someone find housing, learn coping skills, return to work or school, reconnect with family, build routines, and slowly start believing that life can get better. I've met people through treatment and hospitalizations who are still my friends today. We are people who work incredibly hard on our recovery every single day and take it very seriously. I live with a severe mental illness called bipolar disorder, and sometimes it comes with psychosis. Others face different mental health challenges or addictions. None of us expect to recover overnight, though, and none of us stop needing the support the moment we got discharged, because recovery isn't a finish line. It's something you continue building one day at a time. For me, community mental health services have been a huge part of my journey. Even though I've been doing really well lately and doing the best I have in a long time, I'm still preparing to attend a recovery focused wellness center in my own community. Programs like these give people the opportunity to keep growing instead of simply just surviving. And even though I'm doing a lot better compared to previous years, I still have a lot that I need to work through. And these programs represent what can happen if we invest in long term recovery and not just a crisis response. Imagine if more communities across Canada had access to supports like that. Imagine if more people had somewhere to go before they reached a crisis breaking point. That's why this conversation matters so much to me. Funding isn't just about budgets, it isn't about organizations, it's about people. It's about giving someone the chance to rebuild their life after their darkest times. Because recovery doesn't happen during one hospital stay. Recovery happens in the weeks, months, and years that follow. And community mental health is what helps make that possible. We have made such big progress in these programs and with CMHA. We should not lose that progress now, especially when they say there's a mental health and addiction crisis across Canada. This is a time where we needed the absolute most, and we need to keep building on it. The good news is that this isn't inevitable. The funding agreement doesn't expire until March 2027. There is still time for governments to renew it or replace it. But public awareness still matters. And if you want to help, you can learn more about the Canadian Mental Health Association campaign, attend their webinar or read the resources, contact your member of parliament and provincial representative to let them know that long-term mental health funding matters to you. Share this conversation so more Canadians understand what's at stake. And if you're able to, support your local community mental health organizations through volunteering or donation. All the links to these resources will be in the description. Because the reality is, mental illness does not wait for the next budget. Addiction doesn't pause while governments negotiate. Crisis doesn't check the calendar. When someone reaches out for help, that support needs to exist right then and there. The decision made before March 2027 won't just shape budget, they'll shape lives. And the question is pretty simple. When the next person asks for help, will there still be someone there to answer? Until the next time, stay curious, question everything. Don't forget to subscribe so you never miss a video. Hit that like button so I know you're watching, and comment down below your opinions on the topic. I'll meet you in the next rabbit hole. Bye.